ensure we never repeat the same mistakes again. COVID has changed our world, and it has changed us. If we don't make this change, then who will? And if we don't make them now, then when? On the 30th January 2020, I declared a public health emergency of international concern over the global outbreak of COVID-19, the highest level of alarm under international law. It's therefore with great hope that I declare COVID-19 over as a global health emergency.
Even before the declaration of the head of the World Health Organization, most countries across the world had already ended their state of emergency for COVID-19, the most severe global public health crisis in decades. In China, 5 million people flocked to the small eastern city in March for its famous meat and grills. The thin wisp of smoke signaled the people's urge to return to the long-awaited pre-pandemic life. During China's 5-day-long Labor Day holiday at the beginning of May, over 270 million trips were made across the country. Global tourism has also rebounded. A UN report shows tourist arrival numbers rebounded to 80% of pre-pandemic levels in the first quarter of 2023. The surge was seen in the 235 million tourists who traveled internationally, more than doubling 2022's first quarter figures. The Middle East has led in tourism recovery, surpassing 2019 arrivals by 15%, seemingly no different from the pre-pandemic era. The world has entered into a new norm.
At one level, this is a moment for celebration. At another level, this is a moment for reflection.
COVID-19 has changed our world forever. The way we live, how we work, as well as our bodies and minds. The pandemic brought people closer and manifested the glory of humanity. Yet, it also tore communities apart with disputes and disinformation, revealing a divided world with imminent issues. As we recall and reflect on the last 3 years, there were lessons and experiences, the loss of loved ones, and heroic sacrifices. The past 1,200 days may be a short period of time in human history, but for this generation, the memories of the biggest global health crisis in our lifetimes will never fade. The world was engaging with an unknown enemy, a new virus that would take millions of lives over the following 3 years. In central China's city of Wuhan, 60,000 medical workers were stretched to breaking point. At first, there were only around 1,000 hospital beds for treating severe cases.
忙不过来，从来没见过这种架势呀，这种阵势。一个病人后面跟着一排病人，一个圈的病人，看着就有一点绝望的感觉到不了头。
哪怕是那个床上的遗体还没抬走，就已经开始人来预定这个床位了。 就到这样的程度。
The whole country was united to give Wuhan all the support it needed. Many countries across the world also supported the fight by providing masks and medical equipment. Urgent supplies and more than 42,000 brave medical workers from across China arrived in the city under quarantine. To receive more patients, temporary hospitals were built. Dozens of designated and general hospitals were also expanded or remodeled. The number of beds for severe cases quickly increased to more than 9,000. The dire situation in Wuhan was also playing out in other places around the world. Doctors and nurses were overwhelmed by the sudden surge in infections. Many were terrified of the new virus, but frontline medical workers came forward at a time when the world needed them the most, risking their lives to save millions of others. Dr. Phoebe Juma had been fighting COVID-19 since Kenya reported its first case. She too fell victim to the disease. After her recovery, she went back to help more patients.
You can't afford to give up. Who will be left to take up that burden?
Dr. Hassan Alumra was a dentist at the Kenyatta National Hospital. In his last phone conversation with his mother, Alumra promised he will be back. A promise he could not keep. The doctor died at 37.
I cannot remember what I did next. I only found people just full in my home. I don't know whether I removed my clothes. I was only shouting, my daktari, Hudson, you have deceived me. Hudson, you never told me the truth that you are going away. That's the time I felt COVID was real, and COVID is really with us, and it can kill anybody at any time.
In Egypt, doctors are getting ready for the worst.
When we learned that it's becoming a pandemic, we summoned all our medical teams and created a crisis plan.
As you can see here, we started our capacity increased. We started to prepare our staff from different departments. Okay, even those who are not well trained at the frontliner. Okay, they have a short course of training and they are participating right now. Okay, we prepared our consumables, the tools that we are in need for.
In Mexico, COVID-19 death exceeded 280,000 a year after the pandemic broke out. On the Day of the Dead, COVID survivors gathered to commemorate their dearly departed. A woman posted a photo of her boyfriend who had recently died. He was about to celebrate his 25th birthday. COVID vaccines were not available in the town where he lived, so he was never vaccinated.
His name was Luis Armando. He was a son, brother, and he was my boyfriend. We shared 10 years of incredible love.
"40-year-old Fabiana Moroccan lost her husband in 2020.
We were in emotional shock. My children and I needed psychological therapy. After they got over their depression, it was my turn, and I became depressed.
Around 7 million deaths have been reported to WHO as of May 2023. The actual toll has been estimated as much higher, at least 20 million. In India, a group of volunteers were determined to give COVID-19 victims who died alone a dignified farewell.
Once lockdown started, a couple of other friends started something called Mercy Angels. They were participating in giving a dignified last ride to somebody. Hello? Morning, sir. Sir, ನಮ್ಮ ಹತ್ರ 2 ಬಾಡಿ ಇದೆ ಸರ್ ಅನ್ಕ್ಲೇವ್ದು. ಒಂದು TCS ಎಂಪ್ಲಾಯಿ 29 ತಿಳ್ಕೊಂಡಿದ್ದು ಅದು ಮ್ಯಾನೇಜ್ ಆಗ್ತದೆ. ಇನ್ನೊಂದು ಬಾಗಲಕೋಟವರು ಬಡ ಕುಟುಂಬ 8 ದಿನದಿಂದ ಬಾಡಿ ಇಲ್ಲಿ ಅಂಬೇಡ್ಕರಲ್ಲಿದೆ. ಅವ್ರು ಡಾಕ್ಟರ್ ಕೇಳ್ಕೊಂಡ್ರು, ನಾನು ತೊಗೊಂಡು ಬರ್ತೀನಿ. ನಾವೇನೋ ಒಂದು ಮಾಡ್ತಾ ಇದ್ದೀವಿ, ನಾವು ನಿಮ್ಗೆ ಹೇಳ್ತಾ ಇರೋದು ಬಂದಾಗ ನಮ್ಗೆ ತೊಂದರೆ ಆಗಬಾರ್ದು, ಆದಷ್ಟು ಬೇಗ ನಮ್ಮ ಗಾಡಿ ರಿಲೀಸ್ ಆಗಬೇಕು ಅಂತ. हेलो सर कावरे करेंगे ओके ओके।
ये नहीं कि कोरोना आया तो टोटली ख़त्म नहीं है, आज नहीं तो कल ये ख़त्म हो जाएगा बीमारी। बट इंसान का वैल्यूएशन रखना चाहिए, वैल्यूएशन ख़त्म नहीं करना चाहिए.
All the technological and scientific advances of recent decades, we are in an unprecedented human crisis because of a microscopic virus. We need to respond with unity and solidarity.
In the face of the first coronavirus pandemic in history, mask wearing, nucleic acid testing, and quarantine measures became the global scientific consensus on epidemic prevention. Such practices led to victory in Wuhan, so other countries and regions followed by taking similar measures. In the vast jungles of Brazil's Amazon region, home to several indigenous communities, despite their relative isolation, communities all across the Amazon region were hit by the COVID-19 pandemic. In March 2020, the Brazilian authorities began an operation to assess the situation in indigenous lands and provide medical assistance where necessary.
We are testing everybody that comes for us for the coronavirus. And after this initial testing, they go to another triage to check if they need any further assistance from other healthcare professionals.
My children were all coughing, and I could hear something on her chest, so I brought them in to be checked. I heard about this coronavirus, but I don't know much about this. They're only coughing. God forbid it will be this coronavirus.
In Europe, as the outbreak worsened in the winter of 2021, Belgium closed schools early for Christmas and asked children to wear masks. Lockdowns imposed in cities from London, Paris, and Rome to New York were part of the unprecedented global effort. Because of differing local conditions and systems of government, however, a unified and concerted international response was hard to achieve. Efforts to counter the disease were also hampered by misinformation. In many places, protests against lockdowns and vaccinations broke out.
It is the infodemics that is affecting people to make the right choice with informed information.
It's just a matter of taking responsibility for your actions. It's a matter of looking out for your neighbors. It's a matter of looking out for the old people in your community. It's a matter of not having children go to school. It's all of these different things.
China did so well controlling the virus and 1.4 billion people. I mean, look at all the people behind me. They believe in their government, they trust their government, and they love their country, plain and simple.
China's strategy has worked. They played the long game. Slow and steady wins the race. China played the slow game for the last 3 years.
Zhou Nanshan, a top Chinese expert on respiratory diseases, estimated that China had prevented nearly 20 million COVID deaths from early 2020 to December 2022. Quarantine measures notwithstanding, however, to win the war against COVID-19, vaccines were needed. And to test the vaccines they were racing to develop, scientists across the world needed volunteers, a lot of them. In Indonesia, Helena Augustin volunteered for trials as part of the joint development program between her country and China. For her, these were more than just medical trials. They were a humanitarian act.
My motivation is just being a human being. I want to be benefit for others, and if it can be benefit for this health and this pandemic, then why not? I do it for humanity.
In 2020, more than 2,000 volunteers received the vaccine in the country. For the next 6 months, their conditions were closely monitored. If the trials proved to be successful, Indonesia could produce 250 million doses annually. The volunteers' bravery offered a glimmer of hope for the world amid the pandemic.
The benefit of this trial will be more important than just my fear.
Thanks to such efforts, the emergency use of vaccines began in late 2020. The next major challenge was to ensure fairness in vaccination. As wealthier nations secure significant vaccine supplies, vulnerable communities and underprivileged groups were left behind, and often the last to receive access to vaccines and other services. With less than 2% of the world's COVID-19 vaccines administered in Africa in 2021, there were growing calls for the continent to be allowed to produce its own vaccines to meet demand.
It is for this reason that South Africa and India proposed the TRIPS waiver at the World Trade Organization to enable manufacturing of COVID-19 vaccines in developing countries.
Nearly all vaccine manufacturers have dialogue with them, and some of them are ongoing, and we'll continue to engage with them and bring the results to you all. I think we really want to make a strong appeal to the continent that going alone will not help the individual cause for the country, but we need to do it collectively.
China was the first country to pledge to making COVID-19 vaccines a global public good, and also the first to cooperate with developing nations to manufacture them.
疫苗是国际公共产品，世卫组织也一直倡导在疫苗的问题上，专利也好，产权也好，就号召大家要把这个放弃，大家一定要联合起来，不光是中国人民联合起来，全世界人民。
Global governments, organizations, and pharmaceutical companies joined the COVAX initiative aimed at ensuring equitable access to vaccines regardless of wealth. The biggest vaccination campaign in history began. More than 11 billion doses were administered across some 180 countries in 2021.
We're sure that it is safe and also good efficacy. We are confident in that.
China also sent dozens of medical teams to countries in need.
Thank you for coming. I speak in the name of Serbian people. You as heroes.
Wow!
Thanks for the heroes elements of the friendship and brotherhood, China and Serbia.
Wow!
Serbia. Thank you.
Hvala, professor.
Over the past 3 years, China has vaccinated 92% of its population. That's about 1.3 billion people. The country has also supplied over 2.2 billion doses of vaccine to the international community. More than 5.5 billion people worldwide have received a COVID-19 vaccine, equal to about 72.3% of the world population. The vaccines, along with mass testing and quarantine measures, bought precious time to save millions of lives and reduce the severity of symptoms as new strains emerged. After more than 3 years, the COVID-19 public health emergency finally ended. Science may save our world from another crisis, but some scars will never heal. The pandemic has left our world upside down, lives lost, families shattered, and millions plunged into poverty. COVID-19 still remains a global health threat. It remains lethal and is constantly mutating. Dr. Wu Jianfeng was among the first medical personnel sent to assist Wuhan in its battle against COVID-19.
新冠这次似乎在慢慢的走向平稳。 但是你谁搞不清楚它未来会不会有？这我觉得很多专家也这样预测，病毒将是我们人类最大的一个挑战。希望就是形成一个共同的合力来去解决这样的一个疾患的。我想以后如果真的有发生这种情况的话，我们能够集中力量共同去攻克它，解决它。
3 years on, the world we knew has changed forever. What's gone may never come back. But for those who survive the turmoil, life goes on. We honor the sacrifices made by humanity and bear the sorrow together. The pain we endured and the ordeals we went through were not in vain. Science and solidarity will help the world forge ahead with hope and keep us ready to cope with the new challenges of tomorrow.